Which of the following vitamin is absolutely essential for collagen synthesis? A. Vitamin A, B. Vitamin C, C. Vitamin D, D. Vitamin K. And the correct answer is B. Vitamin C. Vitamin C is absolutely essential for synthesis of collagen. Vitamin C is the essential cofactor for the two enzymes required for collagen synthesis, prolyl hydroxylase and lysyl hydroxylase. Which of the following is not included in portal triad? A. Portal vein, B. Hepatic artery, C. Bile ducts, D. Hepatic nerve. And the correct answer is D. Hepatic nerve. Portal triads are composed of three major tubes. Branches of the hepatic artery carry oxygenated blood to the hepatocytes, while branches of the portal vein carry blood with nutrients from the small intestine. The bile duct carries bile products away from the hepatocytes to the larger ducts and gallbladder. Which cardiac enzyme has led to increased specificity in the detection of myocardial infarction? A. Myoglobin, B. Troponin, C. Lactate dehydrogenase, D. Creatinine kinase. And the correct answer is B. Troponin. Troponins are the most widely recognized and important cardiac enzymes used in the diagnosis of acute myocardial ischemia in modern medicine. The majority of patients with acute myocardial infarction will have elevation in troponins within 2 to 3 hours of arrival at the emergency department. The amount of air that moves in and out of the lungs with each respiratory cycle is called A. Vital capacity, B. Tidal volume, C. Inspiratory capacity, D. Functional reserve volume. And the correct answer is B. Tidal volume. Tidal volume is the volume of air moved into or out of the lungs during a normal breath. Benign tumors that develop in the adrenal medulla are called A. Neuroblastoma, B. Pheochromocytomas, C. Sarcoma, D. Carcinoma. And the correct answer is B. Pheochromocytomas. Pheochromocytoma is a rare type of tumor that arises in adrenal glands, specifically from certain cells known as chromaffin cells in the center of the adrenal gland called the adrenal medulla. These cells secrete hormones epinephrine and norepinephrine, and the pheochromocytoma continuously overproduces them. Pheochromocytomas originate in one of the two adrenal glands located above the kidneys in the back of the upper abdomen. What does a drop in blood pressure greater than 10 mmHg during inspiration indicate? A. Orthostatic hypotension, B. Pulsus paradoxus, C. Pulse deficit, D. Hypotension. And the correct answer is B. Pulsus paradoxus. Pulsus paradoxus is a decrease in the systolic blood pressure during inspiration. It results from a decrease in cardiac stroke volume with inspiration due to greatly increased left ventricular afterload. The outermost covering layer of bone is called A. Pericardium, B. Perimetrium, C. Peritoneum, D. Periosteum. And the correct answer is D. Periosteum. Periosteum is the outermost covering layer of the bone. Which of the following condition in males may cause infertility? A. Wilms tumor, B. Coronary artery disease, C. Undescended testis, D. Both A and B. And the correct answer is C. Undescended testis. Undescended testicles that are not brought into the scrotum from a young age will not produce sperm. Even with surgical correction, there are higher rates of infertility in men who had undescended testicles when they were young. T wave represents repolarization of A. Purkinje fibers, B. Atrium, C. Ventricles, D. The bundle of His. And the correct answer is C. Ventricles. In electrocardiography, the T wave represents the repolarization of the ventricles. Anemia occurs in patients with chronic kidney disease due to A. Decreased plasma osmolarity, B. Decreased plasma osmolality, C. Decreased erythropoietin production, D. Decreased renin production. And the correct answer is C. Decreased erythropoietin production. When you have kidney disease, your kidneys cannot make enough erythropoietin. Low erythropoietin levels cause your red blood cells count to drop and anemia to develop. Most people with kidney disease will develop anemia. Anemia can happen early in the course of kidney disease and grow worse as kidneys fail and can no longer make erythropoietin. In which phase of mitosis would chromosomes line up at the center of the spindle? A. Anaphase, B. Interphase, C. Prophase, D. Metaphase. And the correct answer is D. Metaphase. Metaphase is the phase of mitosis when chromosomes line up at the center of the spindle. Which of the following cannot be corrected by dialysis? A. Hypernatremia, B. Hyperkalemia, C. Decreased hemoglobin, D. Elevated creatinine. And the correct answer is C. Decreased hemoglobin. Hypernatremia in the setting of volume overload, for example heart failure and pulmonary edema, may require dialysis for correction. And in a patient with significantly elevated potassium levels, that is hyperkalemia, should undergo dialysis. Pharmacologic therapy alone is not likely to bring about adequate reduction of potassium levels in a timely fashion. After emergency management and stabilization of hyperkalemia, the patient should be hospitalized. Abnormally increased creatinine levels related to kidney failure combined with other factors will also need dialysis. On the other hand, for treating decreased hemoglobin, blood transfusion is required. Fluid and electrolyte balance in the body is maintained by which of the following? A. Spleen, B. Liver, C. Kidney, D. Brain. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.